We don't have a plenary for lung cancer this year, which is unusual because we're getting plenaries every year. But I do think that we are fulfilling some unmet needs right here in ASCO. I think for me, the highlight in lung cancer, of course, is the small cell trial with Tarlatamab. We got the DeLLphi-304 is going to be presented this afternoon, but we got the publication online with a New England Journal already. And it's a trial that provided overall survival of over 12 months in second line. And we know that in first line right now, the overall survival with chemoimmunotherapy with durvalumab or atezolizumab, it's about 12 months. So a second line trial overperforming the first line trial, it's an unmet need for the patients. And this for me, it's quite interesting. So we're also talking about some very interesting data this afternoon. I think the best is yet to come. We're recording this today's Monday, right? So Monday afternoon is going to be, I think, the best day for ASCO. We got the data from the Neo-Adoro trial, osimertinib plus chemotherapy for patients that could be resectable. But I think this is also an unmet need, a very controversial study with the data we have published on JCO, not as good as we wanted to, but I think basically it's this. But for me, the largest highlight was hidden into a session, a rapid oral abstract session that was presented this morning, actually talking about time of day for infusions of immune therapy. Patients who were receiving infusions before 3 p.m. had a better result. And it's huge, like huge, a major difference. And it costs like nothing. It's just, you just have to change your patient for the morning. Instead, the patient doesn't have to wake up like at 5 a.m. It can be like noon for having infusions. And there's a major difference in both PFS and overall survival. So I think this would be my plenary for the ASCO, just changing the hour of infusion. They showed like the lymphocyte profiles, they change over time with the infusion early in the morning, maybe because of circadian rhythm. And this for me would be the greatest thing in ASCO because it's cheap and you can have a great impact in your patients.